Ahlan wa sahlan. Welcome to the Kingdom of Saudi Arabia. Welcome to the land of peace. The Kingdom of Saudi Arabia is one of the largest countries in the Middle East and occupies most of the Arabian Peninsula, with the Red Sea and the Gulf of Aqaba to the west and the Arabian Gulf to the east. The country's area is estimated to be some 2.3 million square kilometres, which is the size of the whole of Western Europe put together. Saudi Arabia has an estimated population of 27 million, of which 8.8 million are registered foreign expatriates. Its language is Arabic, and its capital is Riyadh. It has the world's second largest oil reserves and is the world's second largest oil exporter. The climate of Saudi Arabia has two seasons. Winters, from November to February, are cool to warm with occasional rain. Summers, from April to October, tend to be hot and sunny most of the time. The rise of the modern shopping mall in Saudi Arabia has taken place at a steady rate over the last 10 years. National Guard Health Affairs is one of the largest corporate groups in the Kingdom of Saudi Arabia and in the Middle East. It is known for its state-of-the-art healthcare facilities and services. It comprises hospitals, primary healthcare centres, research centres and universities. The NGHA mission is to provide an optimum healthcare to Saudi Arabian National Guard personnel, their dependents and other eligible patients. NGHA also provides excellent academic opportunities, conducts research and participates in industry and community service programs in the health field. NGHA aims to be recognised as an internationally acclaimed centre of excellence to enhance individual and public health status. NGHA lays great emphasis on certain inherent values which each individual employee is expected to demonstrate in their everyday work practices. These values are taken from religious, social and professional principles such as respect for religious and social values, patient safety and satisfaction, quality performance, respect and dignity, and teamwork and productive work environment. NGHA has 4 major hospitals which are formed under King Abdulaziz Medical Cities to signify its corporate identity. These are composed of King Abdulaziz Medical City in Riyadh, King Abdulaziz Medical City in Jeddah, Imam Abdul Rahman bin Faisal Hospital in Dammam, and King Abdulaziz Hospital in Al-Hassa. Each hospital is designed to accommodate a unique and contemporary design of patients' units. Each unit has a nursing core with a view onto a patio with plants and flowers, which adds to a relaxing feeling and comfort for the patients and its employees as well. An overture of these 4 hospitals, its location, facilities and services will be displayed throughout this presentation. King Abdulaziz Hospital in Al-Hassa was founded in 2002. The hospital consists of 3 levels with a total area of 35,000 square metres, which has a 350 bed capacity and can accommodate up to 400 beds. There are 4 operating rooms and 2 day surgery operating rooms, with a main pharmacy, laboratory and a VIP ward. Imam Abdul Rahman Al Faisal Hospital in Dammam is one of the National Guard Health Affairs medical cities. It was officially opened on October 4th, 2002. It has a 100 bed capacity and is considered one of the leading hospitals in the eastern region due to the international accreditation from JCIA for its recognised efforts. Imam Abdul Rahman Al Faisal Hospital consists of several buildings, which include the hospital's building itself, which is divided into outpatients clinic where they have 7,000 patients monthly. Specialised clinics in most medical disciplines are contained within. The emergency department sees up to 4,000 patients per month, where there are also high-quality medical services. In addition to that, there is the medical imaging department, which is equipped with advanced equipment and techniques such as computerized tomography scan and ultrasound. The laboratory and blood bank has state-of-the-art equipment also. King Abdulaziz Medical City in Jeddah has a bed capacity for 600 patients. Since 1982, it has striven to preserve excellence in quality of patient care. With the continuation of development and expansion, it has launched a series of developed medical projects, including the new Oncology Centre, which is the primary oncology research and treatment centre for the National Guard. The hospital also has a satellite 60-bed transitional care unit and the Dar Al Amam Charity Centre, which is located in downtown Jeddah. The Princess Noura Oncology Centre was inaugurated by His Royal Highness King Abdullah bin Abdulaziz Al Saud in April 2001. King Abdulaziz Medical City in Riyadh commenced its operations in May 1983. Since then, it has continued expanding while providing services for a rapidly growing patient population in all of its catchment areas. It now has a bed capacity in excess of 1,000 beds. Today, King Fahad National Guard Hospital has evolved to become part of the King Abdulaziz Medical City, with many other prominent medical centres. Since its inauguration in February 2001, and within a short period, KAMC has been recognised as a distinguished healthcare provider. The cardiac and surgical facilities of King Abdulaziz Medical City Riyadh are among the finest in the kingdom. Its cardiac centre has one of the most comprehensive programs for the management of heart problems in Saudi Arabia and the Gulf region. This internationally accredited centre provides a complete range of high-quality cardiac services to both adults and children, and offers a full range of cardiac services. The facility currently operates 4 state-of-the-art catheterization laboratories, 4 operating rooms, and a growing number of beds and cardiac-related support services. A total of 100 beds are now operational, with 45 beds as intensive care, including a medical cardiac ICU, a cardiac surgical ICU, pediatric cardiac ICU, and a coronary care unit. Sulaiman bin Abdulaziz Al Raji Surgical Trauma Centre, or the Surgical Tower, is a 5-level state-of-the-art building with a 184-bed capacity. The building was constructed to provide services for the rapidly growing population of the King Abdulaziz Medical City Riyadh. It comprises a burn intensive care unit, surgical intensive care unit, surgical unit, adult care unit, male and female surgery, VIP trauma, OR trauma centre, and PACU trauma centre. The Emergency Care Centre at KAMC Riyadh continues to be the best trauma care centre in the Kingdom of Saudi Arabia. It is ranked as the 4th emergency care centre outside the United States of America to provide pre-hospital trauma and life support program. It provides preventive health services, including health education and behavioural modifications to adapt healthy lifestyles. Surgical and critical units include an outstanding burn unit, surgical ICU, endoscopy unit, operating rooms, and neurosurgical and surgical units. Today, the bed capacity of Emergency Care Centre is 85 beds and still expanding. Ambulatory care services and primary health care services provide preventive health services and clinical units, which include a burn unit, a surgical unit, an endoscope unit, operating rooms, neurosurgical department, a rehabilitation department in occupational and physiotherapy, an IVF clinic with medical imaging, laboratory, and a pharmacy centre. In addition, National Guard Health Affairs will also open a hospital in Al Madina Al Munawwara. The commissioning of Prince Mohammed bin Abdulaziz Al Madina Hospital is planned to be operational by the second quarter of 2012. Aside from the hospitals and primary health centres, NGHA improves and develops the King Saud bin Abdulaziz University for Health Sciences and the King Abdullah International Medical Research Centre. The following were established to carry out NGHA's major mission, not only to provide the highest quality healthcare to patients, but also to promote community health. Joining the team of King Abdulaziz Medical Cities offers a unique opportunity to work and share a lifestyle with a multicultural group of skilled and devoted professionals from over 50 different nationalities from all over the world. Employees enjoy substantial benefits such as a tax-free salary, fully furnished housing accommodation, transportation services to and from work, free mobilisation and demobilisation flights to and from point of origin, 30 days of annual leave per year, 11 holiday leave days per year, mid-year benefits of a mid-year ticket and 10 days post-leave, overtime pay, a Saudi Service Award of half a month's basic salary for each of the first 5 years of service and 1 month's basic salary for each year of service thereafter, free medical care, annual vacation air tickets to point of origin, free uniform and laundry, recreation services, a 12-month renewable contracts, merit increases upon renewal of contract, availability of on-the-job training and training courses, entitlement to promotions and transfers. Be part of the National Guard Health Affairs and enjoy these benefits while experiencing the diverse community of the Kingdom of Saudi Arabia.
Hello, my name is Joan Murray. I'm the Associate Executive Director for Nursing Services in Riyadh, which is in the centre of Saudi Arabia. I have actually joined National Guard in 1987 as a staff nurse and subsequently became a manager and then left nursing for 5 years and worked in medical services. And then I came back to nursing as a director and was subsequently promoted to the Associate Executive Director position in 2003. And the reason I'd let you know this information is to let you know that there's lots of opportunities in National Guard, and I've been here a very, very long time. The hospital in the central region has about 1,000 beds, but we're expanding all the time. We have multiple subspecialties in nursing, which makes it a very exciting place to work and learn professionally. And lots of opportunities to develop new experiences and new skills within nursing. We're also very closely affiliated with the King Abdullah Research Centre, so we have a very active and interesting research agenda, which is nursing sensitive, which is specifically focused on nursing, which is a big gap in the current literature. We also work very closely and are affiliated very closely with the King Saud bin Abdulaziz University for Health Sciences, which means that we work very closely both on their undergraduate programs and their postgraduate programs, and are in the process of developing master's programs for our Saudi nurses. We work also, luckily, with our a nursing education centre, which actually reports to my office also, and we have many sponsored programs for our expat nurses as well. And we have lots of study groups going. Everyone here is studying, either doing masters, degrees, PhDs. So there's a lot of interesting people to meet and other study groups to join if you're interested in professional development. Career enhancement is certainly, I'm a good example of that, as many of my colleagues are. Lots of career opportunities, and we have very structured retention programs which will help you develop professionally and personally while you're with us. We have career advisory service for staff when they come in, and they're very welcome to come and talk to us about their career aspirations after they've been a year, so that they have lots of opportunities available. For new staff coming in, we know it's a very difficult first year. I still remember my first year in Saudi Arabia and adjusting, and it was not easy, but it's well worth the effort, and we have developed now a quite supportive induction program where we have at least 2 to 3 weeks actual orientation to our environment, and then we also have an external sort of support person who actually is someone that new staff can go to and ask for advice, who's not directly involved in the management processes, so it's confidential. We also have a very flat management structure. It's important to us that we maintain a close relationship with our new staff and our frontline staff, and so we have a very tight management structure. We don't have too many layers. We see each other even though it's a big organisation, and our frontline staff are all involved in unit profiles, unit committees that help deal with making changes at the front line for patient safety and staff satisfaction. If you're interested in working in a dynamic and professionally exciting environment, I look forward to meeting you when you come to Riyadh.
Hello, my name is David White. I'm a Director of Clinical Nursing here at National Guard Hospital in Riyadh. I'm from Sydney, Australia, and I've been here for over 4 years. This is a wonderful place to work. It's very dynamic, it's extremely complex, and it's an extremely large organisation. There's genuine opportunities for anybody who wants to be here to travel, to further their career and to contribute to the health of the Saudi national people. I've made some excellent friends here. The accommodation living resources is first class, very, very nice. And the colleagues I've developed here, the friends I've developed here, I will have for life. They're very good people, both the expatriate community that I work and live with and many of my Saudi national friends who I've developed, and I do many things with them outside work as well. So if you're considering coming to Saudi Arabia and work for National Guard, from a personal experience I can tell you that it's very worthwhile. It is not easy at the beginning, but it is very enjoyable and it's very rewarding. So I encourage you to take that step, take that plunge and come to Saudi Arabia and work for the National Guard.
Hello, I'm Heather Byrne and I'm from Christchurch in New Zealand. I'm at National Guard Hospital as the Director of Nursing Education. I've been here since February 2011. I was here before. 2 years ago I went home and 2 years later I've come back. I enjoy it here, otherwise I wouldn't have come back. Just to give you an idea of some of the things that we can do while we're here, I think National Guard is a friendly little hospital. It's a very professional hospital and we have a lovely education facility here which is quite new for us and we're very pleased to have it. We have a lot of things that we do in the Kingdom. My husband is with me, he also works in the Kingdom, so we have the luxury of having quite a good social life. We spend some time at some of the embassies, we walk in the desert, meet with friends. So from my perspective, the social life here is rather lovely. But I'm sure what you'd really like to hear about is the hospital. The hospital is huge, it's very, very busy. It has a lot of educational opportunities for you. The patient care is very good and it's very different, I'm sure, to anywhere else that you've ever worked. I think if you did decide to come to the National Guard, you'd have a really lovely time. It is actually one of the friendliest hospitals in the Middle East. I've worked in another hospital here and I must say it's much, much more friendly than the other hospital I worked at.
Hello, my name is Tara Conboy and I'm from County Donegal in Ireland. I'm currently working at King Abdulaziz Medical City as a nurse specialist supervisor in the cardiovascular disease management program. I first came to Saudi Arabia in 1996 with really the intention of only staying a year, 2 years maximum. I initially came for travel and for the experience of working in a multicultural environment. However, I was really impressed by the quality of care that's provided in King Abdulaziz Medical City, as well as the wonderful career opportunities. So if you're considering coming to King Abdulaziz Medical City, I think this is a very wise decision. I don't think it's one that you'll regret. For the career opportunities, the wonderful travel, the quality of care that's provided, and the experience of working in a multicultural environment. Thank you.
Hi there, my name is Sheila O'Connell. I'm from Dublin in Ireland. I'm a nurse manager here at the Cardiac Surgery High Dependency Unit in King Abdulaziz Medical City. I first came here 14 years ago as a staff nurse for 1 or 2 years. Plans change, however, and I found myself back in Saudi Arabia for the third time. What appeals to me is this hospital is very dynamic. I've watched it grow over the years. It's constantly striving to increase its standards and enhance its services. Saudi Arabia has a fascinating culture and has a lot to offer the avid traveller. The people have always been very, very friendly to me and made me feel welcome. Developed a very nice standard of living here, which I'm getting very used to. If you're thinking of coming to Saudi Arabia, I would urge you to do so. It's a good place to work and full of good people.
Hello, my name is Jackie Reedy. I'm from Ireland, County Kerry in Ireland. I'm the nurse manager here in the emergency room at National Guard Health Affairs. I would like to say I came to Saudi about 10 years ago. I came here for travel. I came here to meet people, work in a multicultural environment, and work in a hospital which would challenge me. I must admit I found that. I really have enjoyed my stay at National Guard. I've met some wonderful people since I've been here. I have travelled, I have managed to save some money, so if you're interested to come working, I think this is a very good decision for you. So enjoy, good luck, thank you.
Think international. Think of working at one of the National Guard Health Affairs hospitals. It's just an application away.